Hello, my name is Dr. Labaugh, and at my office, Back to Health, we are taking a new approach to treating your peripheral neuropathy. We are treating peripheral neuropathy patients in a completely new and different way and getting some pretty outstanding results. So the reason that we are getting different results in our office than what you've experienced in working with your medical doctor, your neurologist, is because we are treating peripheral neuropathy in a completely new and different way. Your medical doctor, what they do, they give you medications that numb your brain's ability to sense that there's a problem in your nerve endings in your feet. We are actually treating the nerve endings in your feet and trying to get those nerve endings to heal, grow, and repair. One of the things that I will hear patients coming into me is, whether it's a friend or a family member has told them, they said, oh, I have peripheral neuropathy because my nerves are dead. What I'm here to tell you is that we know that very likely the nerve endings in your feet are not dead. They are there. They are just dysfunctional, okay? They are sending signals. They're just not sending the appropriate signals at the right time. And your brain takes those mixed up signals and it interprets them as numbness, tingling, burning sensation. Very much likely back in the day when we had televisions that had antennas, when the antenna wasn't set properly, you still were getting some signal to your TV, but it was kind of fuzzy and it had like that snow look to it, right? That's what peripheral neuropathy is in the vast majority of cases. The nerves are not dead, they are just dysfunctional. And if we can correct that dysfunction and get those nerves firing properly again, we get a great improvement in the sensations of peripheral neuropathy. We get a great decrease in pain, numbness, tingling, burning, all those things that peripheral neuropathy patients complain about. Now, the way that this works, and this is going to be very quick because this is all much outside of the scope of this quick video, we know what causes nerves to become dysfunctional. We know there's mitochondrial dysfunction, which has to do with the energy production in the nerve. We know that there is a dramatic decrease in vascularity, so there is a loss of blood supply. This leads to poor nutrition, poor waste elimination, and poor oxygen for the nerves, and that causes them to be dysfunctional. And we also know that there is an NAK pump dysfunction that occurs in the cellular membrane here. Again, I could go into all this stuff for hours on end, but just a quick video here, a little insight. The therapies that we are using in our clinic are actually working to correct mitochondrial dysfunction. They increase vascularity, they bring tissue oxygenation in, and they improve NAK pump function. So again, just to reiterate, a lot of people think that they've got normal nerves over here, and then the nerves die, and that's when you get peripheral neuropathy. And really, the way that it works is that you're born with normal, healthy nerves. Over a period of time, these nerve endings start becoming damaged. They get a certain amount of damage, and they start to elicit some level of dysfunction. Now, most patients will interpret this as a little bit of numbness or tingling in their toes, and they look past it. They don't do anything about it. Maybe they just take medications to cover up those symptoms. As the nerves continue to worsen and worsen and worsen, that's where they can eventually end up as dead nerve endings. So when I meet with someone that's got some numbness and tingling in their toes, time is of the essence because we've got to get those nerves healthy again so that we can avoid the onset of peripheral neuropathy and worsening of peripheral neuropathy symptoms. Because peripheral neuropathy symptoms start when you start feeling that dysfunction and won't continue until those nerves eventually do end up dead. Obviously, the further along this continuum your situation has moved, the harder it is to get those nerves back to healthy again. I liken this to a plant. I'm a plant guy. I really like plants, but I also like to travel. So, if I leave the house and I'm gone for 7 to 10 days and I come home, I have plants that look like this. The plant on the left here. Now, if you're not a plant person, you may look at that and say, oh, that plant's dead, throw it out. And really, if you give that plant what it needs, you give it some sunlight, you give it some water, some nutrition, boom, it'll bounce right back. Okay, this is what your peripheral nerves are like in your feet. They have a great ability, a great potential to heal. You just got to give them what they need and they can bounce back. So what exactly are we doing? In our clinic, we are using two pieces of equipment on our peripheral neuropathy patients. We are using the Sumis Horizon Class 4 medical laser system, and we are combining that with the Synexus Neogen electroneuromodulation system. Now, each one of these systems in research is showing 85 to 90% success rates in reducing patients' pain and improving their peripheral neuropathy. Each one of these can do that on its own. And in fact, there are many offices in the United States and around the world that are using one or the other of these machines. At Back to Health, we are putting them together in our peripheral neuropathy protocol. Here's a little bit about the Class 4 medical laser that we use in our clinic. Study here that was done and published in the Gynecologic Oncology Journal. They found nearly 90% of patients in this study experienced significant improvement in their peripheral neuropathy. And once patients complete their laser therapy in our clinic, we move them right into a session on the Synexus Neogen system here. Study that they did with the Synexus Neogen, they found that approximately 83% of patients in this study reduced their pain by at least 50%, and they had no adverse side effects whatsoever. An interesting thing with the Synexus Neogen system, this study, they actually did what are called epidural nerve fiber density tests, where they took a piece of skin out of the toes and they looked for the nerve endings pre-treatment, and then they did it post-treatment as well. And they found that they actually had an increase in nerve density. So they got more nerve endings, and the nerve endings regrew into the feet in 73% of the patients that were undergoing this treatment. So when you look at the approach that we're taking, where we're actually treating the nerve endings in your feet, there is no medication, there is no treatment protocol that any medical doctor is going to do with you that has any hope or any chance of doing anything like this. Those medications are simply going to numb your ability to sense that there is a problem in your feet. So as you're feeling like maybe you're getting some pain relief, the condition, the nerve endings are actually getting sicker and sicker and sicker, and the condition is getting worse and worse and worse, right? That is certainly an approach that most patients will take, but if you want to take a different approach, that's what we're doing. We are actually working to get the nerve endings in your feet to heal, grow, and repair. So what exactly is the treatment protocol that we're using? The majority of the patients that we'll meet in our clinic will actually tailor a plan for them to do 24 visits over a 12-week period of time. Each visit, so the patient come into the clinic, they're going to do the medical laser, we'll apply that to the legs and the feet, and then we follow that by a session on the Synexus Neogen system. Each visit, I would say you would plan to be in my clinic for 45 to 60 minutes for each treatment session. As I said before, my name is Dr. Nathan Lawball. My clinic, Back to Health, is located in Tannersville, Pennsylvania. And, we've really taken quite an interest in working with patients that are suffering with peripheral neuropathy, and I would love to do the same with you. If you're suffering and you would like to take a different approach, please reach out to us, get a hold of me. I'd love to hear about your situation and see if the protocols that we are using in our clinic might be a good fit for you.